Step 1. Open the browser on your desktop or tablet. Use the provided link and log into the system. Step 2. Input the unique patient number and click Search. Open the patient record by clicking on the patient ID. Step 3. Filling the questionnaire. You will see that some of the fields are already pre-populated. Please note that answers no and unknown are two different cases. Use unknown only if you are not able to check the question. For example, for the presence of left ventricular hypertrophy. If you see on ECG that there are no signs of this condition, please check no. If you don't have ECG information, please check unknown. To speed up the process, you can use this button. These fields are always mandatory for input. This field is used to set up the personally recommended upper normal level of systolic blood pressure to be displayed on the blood pressure progress graph. Usually, it's about 120, but for the particular case, it could be higher. When you finish data entry, the Calculate button will be available. Click and scroll down. This results section is only for clinicians. The next step for you is preparing the final summary. Step 4. Patient Summary Composition. The patient summary has 3 main sections: Conclusion, Recommendations, and Graphs. Conclusion. It is an auto-generated sentence that explains the results of the stroke risk assessment. Recommendations. Recommendations will be provided for those risk factors which have been identified through the questionnaire. Using checkboxes, you add a particular recommendation into the final summary. Please pay attention to this one, because it's the most important for secondary stroke prevention. This recommendation could be tuned up to the particular case. You will see that some of the options are highlighted. When you check any of the options, a special sentence will be added into the recommendation text. Graphs. To add graphs, you can use this button to select all the graphs available. Then you can uncheck some unneeded graphs. We suggest leaving all the graphs where you have any data, even if it is only one value, because there is additional information on each graph about the impact of this risk factor on the stroke risk. We have 2 graphs that are also available. They are about recovery, recurrent stroke risk, reduction, and treatment impact. Please check the needed options according to the medications that you checked in the recommendation. This QR code could be used to transfer the results of the PreventS-MD assessment into the stroke riskometer. After you have finished composing the final summary, you can review how it will look when printed. You'll see all the selected recommendations and graphs are here. Now you can proceed to printing or saving as a PDF. Goal setting step. This step consists of 2 subsections. First, we need to assess the patient's motivation to control any other revealed risk factors. You'll see a generated questionnaire. This one is interactive, so for those modifiable risk factors, we need to ask patients on a scale from 0 to 10 how motivated they feel to make changes in order to reduce their risk. Please input the answer and save the values. This questionnaire could also be printed out if you want to give it to the patient to think about and input their answers. Setting the goals. Goal setup will be available only for those risk factors where the motivation was 5 or higher. In this particular case, only for elevated blood pressure. You choose the risk factor, then you choose one of the templates for the goals. If needed, you can edit this goal or make it more personal. It is suggested to set up no more than 3 goals during one visit. After you set up the goal, click Save and it will appear in the goals history. We have one more step here. Please use this print self-efficacy questionnaire. This questionnaire will also ask the patient to input their beliefs about self-efficacy to achieve this goal. You will give this printout to the patient as a reminder about the goal that you agreed upon, but you need to transfer their answer into this field and save. For further details, contact us today.